Hello guys, welcome back to another episode of STIs, and today's video we're going to talk about chlamydia. Chlamydia is also a common sexually transmitted infection, and you may not know you have chlamydia because many people do not develop any signs and symptoms such as maybe the genital pain or vaginal discharge or urethral discharge. Chlamydia affect both men and women and occur in all age group. Though it is most prevalent among young women, chlamydia is not difficult to treat once you know you have it. If left untreated, chlamydia can lead to more serious health problems. So we will look at this serious problem. So the next part of this video, let's talk about signs and symptoms. Early stage chlamydia infection often cause few or no signs and symptoms. When signs and symptoms occur, they usually start 1 to 3 weeks after exposure to chlamydia. Even when signs and symptoms occur, they are often mild and they don't cause a lot of discomfort. That is why most people don't seek medical attention at the right time. So signs and symptoms that may present, or that a person who is having chlamydia, maybe at the late stage will present with, is painful urination, lower abdominal pain, vaginal discharge in women, discharge from the penis in men, painful sexual intercourse in women, bleeding between period and maybe after sex in women, and maybe we can have testicular pain in men. So those are some of the signs and symptoms of chlamydia. So what causes chlamydia? Chlamydia is caused by bacteria, and it's most commonly spread through vaginal or oral or anal sex. It's also possible for a mother to spread chlamydia to her child during delivery, and this will cause pneumonia or a serious eye problem in the newborn. So let's look at those who are at risk of chlamydia. Who are those group of people who are at risk of getting chlamydia? There are those who are under 24 years. These are the people who want to explore more about sex and they are at risk of getting chlamydia. And those who are having multiple sex partners, and also those who are not using condom maybe consistently and they are having sex with different people. And also if you have history of sexual transmitted infection, you are at risk of getting chlamydia. So what I can say, we have seen that the risk factors of, those who are at risk of getting this sexually transmitted, from the first episode to this episode, we have seen that those who are having multiple sex partners, those who are not using the condom, those who are not using those who are not faithful to one another. So those are the things that you can do in all these sexual transmitted infection to prevent getting infected. So let us look at complication of chlamydia. A woman can have pelvic inflammatory diseases. A man will have epididymitis. Then also they can have prostate gland infection, and also newborn may have some problem. Infertility may set in, and also you can have reactive arthritis. So those are some of the complications that a person will present with when you have chlamydia. And how we usually diagnose chlamydia, it's about a swab on the urethral discharge, and also you can do the urine test. Treatment of chlamydia, it's usually with antibiotic. You may receive a one-time dose, or you may need to take a medication daily or multiple times a day for about 10 days, and then you will get treated. It will just go. In most cases, the infection resolves within 1 to 2 weeks. During that time, you should abstain from sex because you can still reinfect others. So that is what you can do, so that you don't reinfect, or you don't infect others. So this one was not long, and I think this is the end of it. So let's meet in my next video, and we will be now in episode 5. Make sure you watch this video because they are helping you to know. Maybe if you have any question, feel free to ask. I usually still have few audience, and I can communicate with them freely. By the time I will have maybe large audience, I will not be able to communicate with you. So take this advantage of maybe asking question in the comment section, or telling me what you want me to talk about. It's also easy for me, and it is also helpful for you. So let's meet in my next video. Bye.